Very good evening, ladies and gentlemen. Great to see you again on Zoom meeting. So, as we are waiting for more people joining us, we will introduce you of today's two hosts, me myself and Madam Linda Jin, and we will share with you the first topic of today would be why do people experience brain fog at a young age? And Linda Jin will show you the common health conditions like TB, tuberculosis, and more. Let me make sure I've already set you as a co-host. All right. Okay, no problem. So now, if you allow me, we will get started with the first topic of today's training. Uh, so you may know the feeling when you walk into a room and forget why you're there. You struggle to find a simple word, like your brain's search engine is buffering. A task that should take 30 minutes stretches into 2 hours because you just can't focus. This isn't just everyday forgetfulness. It's what many people call brain fog. And if you're young and experiencing this, you are not alone. While we often chalk it up to a senior moment, brain fog is increasingly common among teens, students, and young professionals. So, what exactly is it? And why is it hitting the younger generation? Let's dig deep and find out more. First question, what is brain fog? Well, it is also called mental fog. Let's be clear. Brain fog isn't a formal medical diagnosis. The doctor wouldn't say that to you, but rather it is a symptom of something else. It's a catch-all term for a suite of cognitive troubles that make you feel like you are operating in a mental haze. Unlike normal mental fatigue, which is temporary overuse of your cognition, brain fog feels more persistent and can occur even without significant mental exertion. Now just imagine your brain is a high performance computer. When it's running smoothly, you can multitask, access memories quickly, and solve complex problems. So brain fog is like that computer being overloaded with too many tabs open, running on lower power and needing a critical software update all at once. So this is basically a brief introduction of brain fog and what is it. Now let's see the scenarios, the common sensations of brain fog. Brain fog manifests as a pervasive and frustrating constellation of cognitive symptoms that collectively make your mind feel sluggish and murky, much like trying to think through a dense mental haze. One of the most common signs is a significant decline in working memory, where you might frequently forget why you enter a room, lose your train of thought mid-sentence, or struggle to recall a familiar name or word. Experiencing that notorious tip of the tongue phenomenon. This is often accompanied by executive dysfunction, which impairs your ability to focus, maintain attention on a single task, follow complex instructions, or make decisions, leading to easy distractibility and a feeling of being mentally overwhelmed by tasks that were once manageable. Furthermore, you may experience a noticeable slowing of mental processing speed, feeling as though your thoughts were wading through molasses, taking longer to understand information, formulate responses, or complete routine mental tasks. This cognitive sluggishness is frequently paired with a profound sense of mental fatigue, where even simple thinking feels exhausting, and a general lack of mental clarity that makes it difficult to organize your thoughts or see a clear path forward, ultimately impacting productivity, communication, and overall quality of life. So these are all common senses of brain fog you may confront. Now let's see more. How does brain fog happen? You may ask a question to yourself, why me? Why so young people like me have this problem? It's a myth that only older adults worry about their cognitive health. Young people are uniquely vulnerable to the modern triggers of brain fog. Here we list some of the common culprits. The first one, chronic stress. And this is also the big one. Your brain's alarm system, the amygdala, is great at handling short term threats. But the constant low grade stress of modern life, the deadlines, social pressures, financial worries, uh, keeps this system activated. This floods your brain with the hormone cortisol, which in high doses can be toxic to brain cells and disrupt the delicate circuits in your membrane, in your memory and learning center, which is the hippocampus. Second reason is sleep sacrifice. Pulling all-nighters or sacrificing the sleep for screen time is a direct attack on your brain. During deep sleep, your brain performs essential housekeeping. It clears out toxic waste proteins and consolidates memories during your sleep. While skipping on sleep means you wake up with a dirty brain and fragmented memories, which is a perfect recipe for fog. The third reason, digital overload. The constant pings from notifications, the endless scrolls of social media, and the pressure to be always on are fracturing our attention spans. Your brain wasn't built for this level of multitasking. Each switch between tasks burns precious mental energy and make deep, focused thoughts nearly impossible. The third reason is dietary downfalls. A diet high in processed foods, sugar, and unhealthy fats can fuel inflammation throughout the body, including the brain. These can impair the function of neurons, which are your brain cells. Conversely, skipping meals can cause blood sugar to crash, depriving your brain of its primary fuel, which is the glucose. When we take in carbohydrates, uh, our body will bring those carbohydrates into glucose inside our small intestine and to be absorbed into the bloodstream. In that case, our blood sugar levels uh, uprise, right? Rises. So, uh, at in that case, the only one hormone that can help our body cells use the glucose as energy is insulin. So the insulin is secreted by our pancreatic beta cells uh, in large amounts if we eat a lot of carbohydrates, a lot of sugars. In that case, our blood uh, sugar levels will, go to like, this way, sharp decline. Then uh, after the insulin, works away, uh, weed away, your blood sugar levels will go rise again. So it just like, a crash, then go up high. Uh, in that case, your brain will be suffering from the crash of the glucose, thus the brain fog. So that's all the reasons why younger people have brain fog. Uh, Also, there's a reason coming from the after effects of COVID-19. Long COVID has brought brain fog into the spotlight. Many young, otherwise healthy people report persistent cognitive issues after COVID-19 infection, likely due to inflammation and changes in brain structure. Uh, some research shows that your immune system could cause inflammation in your brain, which is neuroinflammation, that temporarily blocks or makes it more difficult for you, for your body to process information. Regarding brain fog and COVID 19, new research shows that brain fog is a result of the virus living in your gut after infection symptoms resolve. It changes your gut's microbiome. We know that in our gut we have trillions of microbiome, right? Beneficial bacteria and bad bacteria, as well as conditional bacteria. So those viruses will change that structure, make you have more bad bacteria. These can reduce how much serotonin, which is a chemical messenger your body produces, which can impact cognitive function and lead to symptoms of brain fog. Being sick can have lingering effects, so it's pretty normal to feel a little bit off even though you are recovered from an illness. The flu, COVID-19, or even just a bad cold can make you feel like your brain's still trying to play catch up. While you might feel like jumping right back into the full swing of things, sometimes it's best to hold back and give yourself the time you need to recover fully. So, to conclude, uh, there's no worry about the after effects of COVID 19. You just give it time to recover from brain fog. Let's see another reason. uh, Mental health. Uh, this is a red flag uh, of mental issues of brain fog. Anxiety and depression are strongly linked to cognitive difficulties. Feeling blue or stressed out once in a while is normal. But if you've been anxious, on edge, sad, or hopeless for more than 2 weeks, you might find it hard to think clearly. That's because depression, anxiety, and even high stress can be mentally exhausting. These feelings can steal your focus from your day to day tasks. If depression or anxiety are behind your brain fog, you might have those other symptoms, such as sense of hopeless, constant worrying, sadness, or empty feeling, or feelings of guilt, worthlessness, hopelessness, loss of interest in or inability to enjoy activities you really like, low energy, loss of appetite, and weight loss or overeating and weight gain, as well as changes in sleep patterns. If you think you have depression or ongoing anxiety, then you need to see a doctor. Going without help can make it worse. Medication, talk therapy, or often both can help. Another reason is underactive thyroid. Thyroid issues can significantly impact energy and focus. Your thyroid gland is a butterfly shaped organ located in your neck. If it doesn't produce enough thyroid hormones, many parts of your body, including your brain, may not function as quickly or efficiently as usual. That can lead to forgetfulness and trouble thinking clearly. If your thyroid is the problem, you might also feel very tired, gain weight for no apparent reason, feel weak, stiff, or sore in your muscles. You have less tolerance for cold. You become constipated. If you think you have hypothyroidism, which is low functioning of thyroid, you can see a doctor. Uh, and a daily pill can replace the hormones that your thyroid doesn't make. Another reason can be nutrient deficiency. Low levels of vitamin B12, vitamin D, or iron are common culprits. Vitamin B12 is especially important for maintaining healthy nerves and blood. When you don't get enough of it, you may find it hard to focus. Some people don't eat enough B12 rich foods like meat, eggs, and dairy products. Others may not absorb it properly. These can simply happen to some people, or it can be the result of weight loss surgery. Besides the loss of focus, other signs of low vitamin B12 include muscle weakness, numbness or tingling in hands, legs, or feet, difficulty walking, feeling very tired or weak. Your body has a harder time absorbing B12 as you get older. If you think you are low in vitamin B12, you can simply talk to your doctor and supplement this element. Your body needs this vitamin in order to function normally. Depending on your level, you may need B12 shots or pills or a daily multivitamin. Another underlying health condition causing brain fog is autoimmune diseases. Conditions like lupus, rheumatoid arthritis, or multiple sclerosis can cause inflammation that affects the brain. Multisclerosis affects the central nervous system. With multiple sclerosis, your body doesn't send information between your brain and other parts of your body the way it should be. That can make it hard to concentrate, problem solve, focus, and even speak and understand others. Multiple sclerosis almost always causes other issues too. Other signs include muscle weakness, numbness, exhaustion, vision problem, trouble walking. So, if you have brain fog and other symptoms of multiple sclerosis, just talk to your doctor. So far, there's no cure for this condition, but medication can improve symptoms, speed up recovery from attacks, and slow the progression to uh, slow the progression of the disease. Another one, systemic lupus erythematosus. Uh, these can cause brain fog primarily through direct autoimmune mediated neuroinflammation and damage. In a phenomenon known as neural uh, psychiatric lupus, the body's own immune system, including autoantibodies like anti-NMDA receptor antibodies, can attack the blood-brain barrier, which is a very thin uh, membrane lining the outside of your brain, protecting your brain from outer side pathogens invading. So, it can target cells within the central nervous system. This direct assault triggers widespread inflammation, disrupts normal neural signaling, and can even cause microvascular damage through vasculopathy, impairing blood flow to delicate brain tissues. So this combination of inflammatory disruption and potential structural damage to neural networks directly interferes with cognitive processes, leading to the characteristic symptoms of brain fog, including poor concentration, memory deficits, and mental slowness. So the systemic inflammation that defines rheumatoid arthritis doesn't just affect the joints. The flow inflammatory cytokines can cross the blood-brain barrier, directly disrupting the function of brain cells, including the neurons and glial cells. This neuroinflammation can impair neural communication, reduce neuroplasticity, and affect key regions responsible for memory and concentration. Furthermore, the constant burden of chronic pain and fatigue, along with frequent sleep disturbances and potential side effects from medications, creates a significant cognitive load, ultimately manifesting as the mental fatigue uh, and potential side effects from medications creates significant cognitive load, uh, ultimately manifesting as the mental fatigue, slow thinking, and memory loss. Memory lapses characteristic of brain fog. So these are all the underlying health conditions that may contributing to you know brain fog. Let's see other reasons. Medications, side effects of from certain medications like some allergy pills, sleep aids, or antidepressants can cause foggy thinking too. Treatments for medical conditions can also affect your mental clarity and energy levels. Medications called anticholinergics can make you foggy too. These medications block the effects of neurotransmitter in the brain and make it difficult to think clearly. Research has also found that chemotherapy can lead to brain fog, which researchers refer to as chemo brain. In many cases, chemo brain clears after you finish your cancer treatment. Another one is hormonal changes. Fluctuations in estrogen and progesterone, like during pregnancy, menopause, or menstrual cycles, can affect memory and concentration as well. If you've ever had premenstrual syndrome, being pregnant, given birth, or experienced menopause, you know how tough those hormonal shifts can get. It can make it harder to focus and mess with your clarity. Another cause would be chronic fatigue syndrome. Brain fog is a constant problem for most people with chronic fatigue syndrome. Doctors diagnose this condition after you have at least 6 months of physical and mental fatigue. Experts still aren't sure what causes it, but problems with memory, focus, and thinking are the symptoms. Other signs include extreme exhaustion for no clear reason, sleep that not restful, joint or muscle pain, sore throat. Actually, there is no cure for chronic fatigue. But if you see a doctor, she or he can offer treatments for your symptoms that may include brain training and specialized physical exercises. Okay, let's see more. Uh, when to see a healthcare provider. We all have those days where we feel kind of off our game. But if your brain fog is sticking around for longer than you'd expect or severe enough to interfere with your daily life, it might be time to chat about it with your healthcare provider. If you always feel spaced out, making it hard to function at work, school, and daily life, that's your cue to seek a professional opinion. If your brain fog is happening with other symptoms like headaches, fatigue, or mood changes, don't ignore it. Just remember, brain fog isn't recognized mental health condition, but it is a symptom of something else that's going on with your health. Figuring out what's causing it is like putting a puzzle together. Your doctor will ask questions about your symptoms, including when they started, how long they last, and how they impact your day to day life. They'll also ask questions about any recent illnesses or stresses, any medications you're taking, and your eating and sleeping habits. They may also want to run some lab tests to help rule out nutritional deficiency, thyroid problems, or hormonal imbalances that could be contributing to your symptoms. So this is the when to see a healthcare professional. Then the diagnostic tests and evaluations are to are what you can learn about might be causing your brain fog. So the tests include blood tests. Uh, your doctor will likely conduct blood tests to look for underlying problems like nutritional deficiencies, such as iron or vitamin B12, thyroid problems, or glucose imbalances, or cognitive tests. Uh, the healthcare professionals will also probably check your cognitive abilities with memory or problem solving tests. These can help them see how your brain is functioning and may provide insights into specific struggles you might be having. And in some cases, your doctor may recommend imaging tests like a CT scan or MRI to check for damage and rule out neurological conditions. Such tests are all about helping medical professionals sift through the clues so they determine why you are feeling so mentally cloudy. So these are the examination and tests you may have. Now, the question is how to manage brain fog. Once you've figured out what might be causing the brain fog, you might wonder, now what? Well, the treatment and prevention of brain fog depend on the underlying causes. If this mental fogginess is linked to something like diabetes, for example, treating that condition can stabilize blood sugar and improve mental clarity. Except for prescribed medications, Greenwald Glucose Block capsule and balsam pear tea help increase insulin production and improve insulin sensitivity so you can have a managed blood sugar levels. Often, brain fog due to COVID or influenza infections will lift once the illness passes. But COVID-19 can last longer in many people, which is so-called post-COVID syndrome. What you can do is to get good sleep and take adequate amount of water and foods rich in antioxidants, as well as boost your immunity. You can take spirulina plus capsule or Ganoderma plus capsule, which help enhance immune system. Taking blueberry super nutrition or blueberry juice helps quench inflammation and accelerate recovery due to the rich antioxidants and anti-inflammatory compounds they contain. Meanwhile, blueberry super nutrition contains nutrients benefiting good gut microbiome, which contribute to brain health. Medications, psychotherapy, or both can relieve symptoms of anxiety, depression, and accompanying cognitive impairments. Greenworld anti-anxiety and stress relief capsule not only promotes sound sleep, but also improves memory, soothes the nerves, and relieves anxiety. Deep sea fish oil capsule is rich in omega-3 fatty acids, especially EPA and DHA. Think of your brain cell membranes as being made of a flexible fluid layer that needs to be in good condition for optimal communication between cells. DHA is a fundamental structural component of these membranes, helping to keep them fluid and facilitate the swift transmission of signals. Meanwhile, EPA is known for its potent anti-inflammatory effects, which can help calm chronic low-level inflammation in the brain. That is often a hidden contributor to the sluggish and hazy feeling of brain fog. Furthermore, these fats support improved blood flow, ensuring the brain receives the oxygen and nutrients it needs to function sharply. Well, for individuals with an underactive thyroid, which is hypothyroidism, experiencing brain fog, certain nutrient supplements can be supportive, but recommendations must be approached with caution and under medical supervision. The most critical is iodine, as it is a fundamental building block for thyroid hormones. However, supplementation is only beneficial in cases of deficiency and can be harmful in autoimmune Hashimoto's thyroiditis, the most common cause of hypothyroidism. Selenium, as contained in sea tablet, is highly recommended as it is essential for converting the inactive thyroid hormone to the active form, and it helps protect the thyroid gland from oxidative damage. Zinc also plays a role in thyroid hormone production and conversion. Additionally, iron is crucial because iron deficiency can impair thyroid function, and low levels are common, especially in individuals with heavy menstrual cycles. Our spirulina is a good source of non-heme iron, which is important for oxygen transport and overall energy levels. 6 capsules of spirulina plus capsule of dry contains about 1 milligram of iron. Spirulina is also a good source of vitamin B12 and folate. These two vitamins are bioavailable and well absorbed by the body. Finally, vitamin D is often supplemented, as deficiency is prevalent in hypothyroid patients and is linked to autoimmune activity. It is vital to have nutrient levels tested before supplementing, as excessive intake can interfere with thyroid function and the absorption of thyroid medication, which should always be taken on an empty stomach for optimal efficiency. Well, for people with chronic fatigue syndrome or vitamin B12, iron deficiency, uh, energy drink can be recommended, as this product is rich in vitamin B6, folic acid, vitamin B12, vitamin C, iron, copper, zinc, and vitamin E, which are the essential nutrients for the body. Apart from iron, vitamin C, vitamin B12, and folate, blueberry super nutrition also contains proteins, dietary fiber, and prebiotics. Dietary fiber and prebiotics create a favorite environment in gut, which increases the absorption of iron and other nutrients for better constitution. While for people with brain fog due to autoimmune diseases like multiple sclerosis, lupus, or rheumatoid arthritis, balancing immunity is the key. Greenworld Ganoderma Plus capsule or Cordyceps Plus capsule can be recommended to regulate the immunity and control the inflammation. Deep sea fish oil capsule can also be recommended, as EPA has potent anti-inflammatory effects, which can help calm the chronic low-level inflammation in the body. As for ladies with brain fog due to PMS or menopause, soy power capsule, deep sea fish oil, and blueberry super nutrition can be recommended. Soy power capsule contains isoflavones, which can mimic or block estrogen depending on the situation. When estrogen is low, like menopause, isoflavones mildly stimulate estrogen receptors. They act like a gentle estrogen booster, easing menopausal symptoms. With PMS, there is hormonal fluctuation. Isoflavones help balance it. Deep sea fish oil capsule helps reduce inflammation and improve mood, while blueberry super nutrition is rich in proteins, vitamins, minerals, and phytonutrients that help with energy boost and inflammation control. Well, the good news is that brain fog is often reversible. You can't power through it, but you can create conditions for your brain to heal. Think of it as system reboot. First one, prioritize sleep, like your career depends on it. Aim for 7 to 9 hours of quality sleep each night. Two, tame the stress beast. You can't eliminate stress, but you can manage your response to it. Even 5 to 10 minutes a day of mindfulness and meditation can calm the amygdala and strengthen your prefrontal cortex, your brain's CEO. Exercise is a powerful anxiety and anti-inflammatory tool. So a brisk walk, a dance, or a gym workout boosts blood flow to the brain. 3. Fuel your brain. Don't fool it. By eating whole foods like antioxidants, rich foods, berries, leafy greens, healthy fats, and complex carbs. Also, your brain is about 75% water. You need to be hydrated because even mild dehydration can impair your cognition. Cut back on sugar, refined carbs, and processed foods because they can promote inflammation inside your brain. Also, do a digital detox. Check emails and messages in designated blocks instead of constantly reacting. Silence notifications during sleep work sessions helps too. And step away from all screens while your brain needs a breaks. Just go outside, stretch, or just stare out the window to let your mind wander and recharge. And also know when to see a doctor. If the brain fog is persistent, severe, or worsening, it's time to see a healthcare professional. So these are all the prevention tips for a brain fog. So, brain fog in young adulthood is a real and frustrating experience, but it's your brain's way of seeing it's overwhelmed. It's a helping sign. So, by listening to that signal and making conscious changes to your lifestyle, and by taking Great World Health supplements, you can lift the haze, sharpening your focus, and get your brilliant mind back online. Well, so ladies and gentlemen, that's all for the presentation about brain fog. Thank you for listening. And let me check the chat box first, what people see. Okay, the slide now moving. All right, maybe the network connection is not that well. So, well, the floor is yours, Madam Lina Jin. You can start.
Okay. Hello, dear Greenworld partners in Kenya. My name is Linda Zheng. Nice to see you. Today, I want to talk with you about tuberculosis, a disease that was historically called the white plague. Have you heard this term before? TB remains a serious health threat, especially in our African region. So today, let's take a closer look at how TB develops in the body, the current situation of TB in African countries, how we can better protect ourselves and our communities from it. Next. TB remains a critical global health threat. Tuberculosis continues to be one of the most significant infectious disease challenges of the 21st century. Shockingly, approximately one-third of the world's population, nearly 2 billion people, have been infected with Mycobacteria tuberculosis. According to the WHO's 2021 Global Tuberculosis Report, there were 9.87 million new TB cases and 1.49 million deaths worldwide in 2020 alone. These staggering numbers confirm TB's position as the leading cause of death from a single infectious agent, surpassing even HIV, AIDS, and malaria. The disease particularly affects vulnerable populations in low and middle income countries, where limited healthcare access and co-infections like HIV exacerbate the crisis. Let's begin by understanding the different types of tuberculosis bacteria. The pathogen responsible for TB belongs to the Mycobacteria tuberculosis complex, MTBC, which includes 4 main species: Mycobacteria tuberculosis, Mycobacteria africanum, Mycobacterium microtype. Among these, greater than 90% of human pulmonary TB cases worldwide are caused by tuberculosis. This particular species has evolved to specifically infect humans and is primarily transmitted through airborne droplets when infected individuals cough or sneeze. Its remarkable ability to survive in human macrophages and develop drug resistance makes it the most significant threat to global TB control effects. So what makes tuberculosis so persistent and so dangerous lies in the troubling nature of the TB bacteria itself. This isn't just another germ, it's a pathogen that laughs at our usual defenses. While most bacteria would die quickly outside the body, TB can survive for weeks in dried sputum, clinging to dust particles that might be inhaled by another victim. It shrugs off coat, resists drying, and withstands many common disinfectants that would kill other pathogens. Even sunlight, nature's great disinfectant, takes hours to break it down. In hospitals, we have to use special UV lamps at precise distances for a full half hour just to be sure it's gone. That's why TB spreads so easily through a simple cough or sneeze. That's why it lingers in communities. And that's why, despite all our medical advances, it remains one of the world's deadliest infections. When we talk about controlling TB, we are fighting against an enemy that's evolved to be disturbingly good at surviving, and that's what makes it so dangerous. TB spreads primarily through the air when an infected person coughs or sneezes. They release invisible droplets containing the bacteria. These can linger in poorly ventilated spaces, waiting to be inhaled by others. 3 key factors determine infection risk: how much bacteria the sick person is releasing, how long you are exposed, the strength of your immune system. Think TB just affects lungs? Think again. Many people assume TB only harms the lungs, but this infection can appear in surprising places throughout the body. Imagine discovering blood in your urine. That could be TB attacking your kidney. Or consider persistent back pain that won't go away. The bacteria might be eating away at your spine. Some patients develop swollen neck glands that never heal, while others suffer from mysterious abdominal pain that turns out to be TB hiding in their digestive system. In its most dangerous form, TB can even invade the brain's protective membranes, causing life-threatening meningitis. While lung infections remain most common, TB's ability to masquerade as other illnesses in different organs makes it particularly tricky to diagnose. The step-by-step invasion of tuberculosis. The journey of a tuberculosis infection begins when a person unknowingly inhales tiny droplets carrying Mycobacterium tuberculosis. These bacteria invaders are far from ordinary. They possess remarkable survival skills that make them exceptionally dangerous. Upon reaching the lung, they encounter the body's first line of defense, alveolar macrophages. Normally, these immune cells would destroy invaders, but TB bacteria have evolved clever tricks to resist being broken down by the macrophage's digestive enzyme. The tuberculosis bacteria can block the fusion of phagosomes with lysosomes, while resisting reactive oxygen species ROS attacks, enabling them to parasitize inside immune cells, turning the body's own defenders into comfortable hideouts where they can multiply undisturbed. As their numbers grow, they begin damaging the lung tissue, creating small inflamed areas known as primary foci. Using the body's own lymphatic system as pathways, bacteria travel to the higher lymph nodes near the lung, causing them to swell painfully. At this critical stage, the infection can take different paths. Sometimes the immune system manages to contain it, but if the bacteria gain the upper hand, they expand their territory in the lungs and may even enter the bloodstream to spread throughout the body. It's only when the bacterial colonies have established themselves and caused significant damage that the classic symptoms of tuberculosis appear. The persistent cough, fevers, and night sweats that signal the infection had fully manifested. When your immune system gains the upper hand against tuberculosis, it doesn't so much win as achieve a tense stalemate. The battle plays out like a microscopic siege. Your macrophages and T cells surround the invaders, building thick-walled fortresses called granulomas to contain them. These aren't ordinary prisons. They are more like high security vaults where the bacteria are forced into dormancy, drastically slowing their metabolism, but not completely dying. Your body maintains this uneasy pace through constant vigilance. Special memory T cells patrol like guides, while signaling molecules, particularly TNF alpha, act as a fortress structural support. Break these signals, say, through immunosuppressant drugs or HIV infection, and the containment can fall. This explains why about 90% of infected people never get sick, yet can't truly claim to be TB-free. The bacteria remain just contained a reminder of how tuberculosis turns even immune victories into prolonged standoffs rather than clean resolutions. Certain groups face significantly higher risks of tuberculosis infection and progression to active disease. People living with HIV are particularly susceptible, as their weakened immune system make them 20 to 30 times more likely to develop TB compared to healthy individuals. Diabetes also face elevated risk because high blood sugar creates an ideal environment for TB bacteria to thrive. Others at risk include anyone with compromised immunity, such as patients on long-term steroid therapy or immunosuppressant drugs. Perhaps most obviously, those in close contact with active TB patients, like family members or healthcare workers, have substantially increased exposure risk. Doctors recognize pulmonary TB through a distinct combination of persistent symptoms. The hallmark is a chronic cough lasting weeks, often accompanied by mild afternoon fevers and drenching night sweats. Patients typically experience gradual weight loss and fatigue out of proportion to their activity level. About 1/3 may cough up blood, while some women notice menstrual changes. Unlike common respiratory infection, these symptoms progressively worsen over weeks rather than improving. The best TB prevention combines vaccination, BCG for children, regular screening for high-risk groups like HIV patients, and practical measures like wearing N95 masks in contagious settings. Maintaining good ventilation, proper cough hygiene, and a healthy lifestyle with balanced nutrition and exercise further reduces infection risks. Early detection remains crucial. Greenwald garlic oil capsule provides nutritional support against tuberculosis through their potent active compounds. The key component, allicin, offers dual action by directly inhibiting Mycobacterium tuberculosis growth while reducing inflammatory damage in lung tissue. These effects are complemented by natural sulfides that strengthen immune defenses and combat oxidative stress caused by both infection and medication side effects. Together, these phytonutrients work synergistically with conventional TB treatment, helping to maintain respiratory health and support recovery. Greenwald Cordyceps plant capsule supporting pulmonary defense. Scientific evidence indicates cordyceps polysaccharides activate alveolar macrophage function, improving bacterial clearance. Cordycepin demonstrates RNA interference potential against respiratory pathogens in laboratory studies. Gisenocytes contribute RB1 contribute to improved pulmonary oxygenation and reduced fatigue. Together, these components provide comprehensive support for respiratory immune function, particularly valuable for maintaining lung health during exposure risks or recovery periods. The next, Greenwald propolis plus capsule. Scientific studies confirm propolis offers multifaceted benefits for lung health. The flavonoids demonstrate antiviral activity against common respiratory pathogens while protecting alveolar tissue from oxidative damage. As a primary bioactive compound, caffeic acid, phenyl ester, CAPE, significantly modulates inflammatory pathways, reducing cytokine production associated with airway inflammation. Propolis polysaccharides concurrently enhance immune cell proliferation and activity, particularly lymphocyte responses. This synergistic combination provides comprehensive support for maintaining respiratory tract integrity, especially during seasonal challenges or prolonged exposure to environmental irritants. Next, Greenwald and cleansing tea respiratory support. Scientific analysis reveals this tea's formulation provides targeted respiratory benefits through its bioactive components. Chrysanthemum flavonoids combined with green tea polyphenols demonstrate measurable anti-inflammatory effects on bronchial tissue. Lily-derived polysaccharides and amygdalin show mucolytic and antitussive properties in clinical observations. The combination of lithium berberine polysaccharide and hallucinogenic chordator enhances immune surveillance in respiratory mucosa, supported by lymphocyte proliferation studies. Okay, next, Next common health topic, lung cancer. My goal is not to alarm you, but to empower you with clear, straightforward information. We will cover what it is, why it happens, how it's found, and how high-quality products from Greenworld can help support nutritional wellness during this challenge. So, what exactly is lung cancer? Simply put, the World Health Organization defines it as a dangerous tumor that starts in the cells lining our breathing passages, the bronchi and alveoli, the, the tiny air sacs deep in our lungs. This isn't a rare disease globally. It's one of the most common cancers. In 2020 alone, there were 2.2 million new diagnoses, making up over 11% of all cancers worldwide. The most challenging part is that it's often found very late. About 3 out of every 4 people don't notice symptoms until the disease is already advanced. Because of this late discovery, the overall survival rate is, unfortunately, still quite low, at around 20%. It's most frequently seen in people between 55 and 65 years old, and it's more common in men than women. You might be wondering, what causes this? The number one cause by far is smoking, but it's not the only one. There are other risks like being exposed to certain chemicals at working, things like asbestos or arsenic. Air pollution, both outside and inside our homes, also plays a role. Another invisible risk is ionizing radiation, like from radon gas that can seep into buildings. Our diet, how active we are, and our genetics can also influence our risk. And finally, other lung diseases like tuberculosis or COPD can sometimes create conditions where cancer is more likely to develop. Now, not all lung cancers are the same. Doctors classify them into different types based on how the cells look under a microscope. The most common way to group them is into two broad categories: non-small cell lung cancers and small cell lung cancer. Non-small cell is the most common type and includes main subtypes like adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Small cell lung cancer is less common but tends to be more aggressive. It's important to know that small cell lung cancer actually belongs to a large family of tumors called neuroendocrine tumors, which also include others like typical and typical carcinoid tumors. These tumors share some biological features. This leads us to a very important question. Why is it so often found late? Our lungs are incredibly strong organs. They have a huge built-in backup system with millions of tiny air sacs. We only use a part of them to breathe. So a tumor can grow for a long time without affecting our breathing. Another big reason is that the lung tissue itself doesn't have nerves that feel pain. You can't feel a small tumor growing. Usually, Pain only starts if the tumor grows large enough to push on the outer lining of the lung, which is very sensitive, or into the chest wall. But by that time, the cancer is often not early anymore. So, what signs should we look out for? The symptoms can include a persistent cough, coughing up blood, or having blood in the phlegm, feeling short of breath or wheezing, chest pain, fever, or losing weight without trying. The tricky part is that these signs are very common. They can easily be mistaken for a bad cold, the flu, or especially for smokers, just a part of their usual smoker's cough. This is why people often ignore new symptoms or blame them on something else, which can delay seeing a doctor. Let's take a quick look at how a normal cell in the lung becomes cancerous. It's a process, not an event. It starts with our normal, healthy lung cells. Over many years, they are exposed to those risk factors we talked about, like smoke or pollution. These toxins constantly damage the cell's DNA. Usually, the cell can repair this damage, but sometimes the repair fails. This leads to permanent mistakes or mutation in crucial genes. These mutated genes act like a car with a stuck accelerator, telling the cell to keep dividing and broken brakes. So it can't stop dividing. This creates a small cluster of abnormal cells. As these bad cells multiply, they gain superpowers that normal cells don't have. They learn to avoid the signals that normally tell a damaged cell to die. They can make copies of themselves almost forever. They can even trick the body into growing new blood vessels to bring them food and oxygen. And they can hide from our body's immune system. Our natural defense army, once they have these powers, they start to invade the healthy tissue around them, forming a mass or a tumor. And remember, this whole process isn't fast. It can take 10, 20 years, or even longer to happen. As a tumor grows bigger within the chest, it can start to cause problems by pressing on nearby structures. This can lead to more specific symptoms like chest pain, a hoarse voice if it affects the nerve to the voice box, or trouble swallowing if it presses on the esophagus. It can cause fluid to build up around the lung or even the heart. It can block major blood vessels, causing swelling in the face and arm, or affect nerves to the eye and face. It might be hard to understand how lung cancer could affect nerves in the face and eyes. In fact, this is due to Horner's syndrome, also known as cervical sympathetic palsy syndrome. It occurs when the sympathetic nerve pathway controlling the eyes and face is damaged. This nerve pathway is very long. It starts in the brain, passes through the spinal cord, chest, and neck, and finally reaches the eyes. Because of its lengthy course, lung cancer, particularly tumors located at the apex of the lung, Pancoast tumor, is an important cause of Horner syndrome. So, what does this look like? The person will have a droopy eyelid, a small pupil, and dry skin. But here is a key. All of these changes happen only on one side of the face. The most critical stage occurs when cancer cells detach from the primary tumor. They may enter the bloodstream or lymphatic system and travel to distant organs. Different types of lung cancer metastasize at varying rates. For instance, over half of squamous cell carcinomas spread extrathoracically. Approximately 80% of adenocarcinomas metastasize. Small cell lung cancer is the most aggressive, with over 95% of cases developing metastases. This process involves steps like leaving the tumor, circulating, exiting the bloodstream, and setting up a new colony, what doctors call metastases. Different types of lung cancer spread at different rates. In fact, about 1/3 of the time, the very first symptoms of lung cancer are not from the lung tumor itself, but from where it has spread. If it spreads to the brain, it can cause headaches, seizures, or balance problems. Spread to the bone can cause severe pain and even easy fractures. If it spreads to the liver, it can cause pain, yellow skin, and loss of appetite. Or you might feel a hard, painless lump in the neck, which is a sign of spread to the lymph nodes. So how do we find it? A simple chest X-ray is often the first test, but small tumors can hide behind our structures. The best tool we have for early detection is called a low-dose CT scan. It's a special type of X-ray that takes very detailed pictures and can find very small spots in the lung long before they cause symptoms. Other scans, like an MRI or a nuclear medicine scan, can also be used to get more information or see if the cancer has spread. The good news is that we have many more treatment options today than ever before. If the cancer is found early and hasn't spread, surgery to remove it can be curative. For other cases, we have strong medicines, chemotherapy, newer targeted therapy that attacks specific mutations in cancer cells, and immunotherapy that helps your own immune system fight the cancer. Radiation therapy uses high-energy beams to kill cancer cells. There are also minimally invasive interventional techniques, and traditional medicines are often used alongside these modern treatments to help manage side effects and improve well-being. Unfortunately, cancer is often detected at an advanced stage. By then, even surgical treatment may not be able to control it effectively. That's why it's so important to care for our lung health daily and keep our immune system strong. In addition to maintaining a healthy diet, engaging in moderate exercise, practicing deep breathing, keeping a positive mindset, quitting smoking, and avoiding secondhand smoke, you can also choose high-quality Greenwood products to support your lung health. The first is cordyceps capsule. Lab studies show that compounds in cordyceps may have anti-tumor effects, potentially slowing cancer growth and promoting cancer cell death. It's also known for its potential to support the immune system, which can be very helpful for patients undergoing treatment like chemotherapy that can weaken immunity. Of course, incorporating this product into your daily routine can also provide enhanced nutritional support for lung health. The next, the Greenwood Ganoderma Plus capsule. It contains triterpene polysaccharide, ganoderic acid. Research suggests this may also help fight cancer by triggering cell death, blocking tumors from creating a blood supply, and limiting spread. It also has strong anti-inflammatory properties, which could help reduce lung inflammation and make breathing easier. Okay, that concludes our sharing for today. We hope you now have a deeper understanding of lung cancer and are more aware of the importance of lung health maintenance. Let's work together to stay away from the threat of diseases. Thank you, everyone.
Thank you, Miss Linda, sharing with us common health conditions about lungs, including TB and lung cancer. Dear friends, family, if you have any question, you may ask. You can unmute yourself or raise your hands. All right. So if there's no more questions, we can call it a day. And we have noticed that there's fewer people attending our online training this day today. So if I've been realized that it's approaching the Christmas holiday, right? You guys are preparing for that, maybe? Okay. All right. So if there's no more questions, so we can call it a day. And have a nice weekend, everyone. Take care. And we'll see you next time.
Thank you. Thank you, everyone.
Good, good night.
Good night.
Good
Thank
night.
you,
Good night.
leadership. Good
Bye.
night.
Good
See you
night.
next
Good night. Good
time.
night.
Nice weekend.
Good night.
Good
Good
night.
night.
Good night. Good night.
Good night, everyone.
Good night.